Hello, everyone, and thank you so much for joining us today for our podcast. I am so excited to welcome my next guest, Julie Soria. Julie is a conventionally and functionally trained nurse practitioner with a specialization in anti aging and regenerative medicine. She is the founder of Beach Cities Wellness, located in Newport Beach, California, and she graduated from Boston University with her Bachelor of Science in Human Physiology. She attended Saddleback College for her associates in nursing, Chamberlain University for her Bachelor of Science in Nursing, followed by California State University of Long Beach, where she received her Master of Science in Nursing. She has continued her training through the Institute for Functional Medicine, American Academy of Anti-Aging, and BioT. Julie has a strong foundation in conventional medicine with over a decade of experience in the emergency department and many years of primary and urgent care. She wanted her patients to be healthier than the limitations of conventional medicine and followed her passion to functional medicine. Julie offers specialized testing to uncover the root cause of illness and develops personalized treatment plans. She uses alternative therapies, including bioidentical hormone replacement, supplements, IVs, lifestyle modification, and nutritional therapy. She is committed to providing high quality preventative and restorative care to have her patients feel better, sleep better, and live longer. I have had the pleasure of visiting Julie and her practice in Newport Beach just a few weeks ago. She has a beautiful space that is so bright, uplifting, and welcoming for patients. She offers amazing functional medicine services along with her IV therapy treatments, peptides, and so much more. Hello, Julie, and welcome to the Women's Health and Fertility Podcast. We are so grateful that you can make it and join us today. And I would just love for you to share with us your origin story, how it all got started for you. You have such an interesting background, and just having that combination of Western medicine and functional medicine, which is so rare to find. And I feel like you have such a great balanced practice, and would love to just hear about how things got started for you.
Awesome. Thank you. Well, first and foremost, thank you so much for having me on your podcast. I'm just honored to be here and be a part of your health conscious community. So I guess about myself, I am a conventionally and functionally trained nurse practitioner. I worked in the emergency department for 11 years before moving on to primary practice and urgent care. And when I was working in, those various settings, primarily primary and urgent care, I just realized that I was hitting a lot of limitations in conventional medicine, and that I just felt like I needed myself and my colleagues needed to treat patients more, that we were missing the mark on some things. And so, I started looking into different types of medicine, and that's where I found functional medicine, which is a type of medicine that really focuses into the root cause of the issue. Of course, we look at symptoms and symptom management like conventional medicine, but it doesn't stop there. If you're having certain issues, I want to dig a lot deeper and really understand the root cause of the illness itself, and heal a person from the very, very foundational aspect of it. Um,
That
and
sounds
so
wonderful. I
thank you.
completely am on board with that too. And it's very similar to what we practice in Chinese medicine too, is kind of treating the root and the branch and not just
Mhm.
the symptomatic symptoms that
Mhm.
patients come with, just right in front of you. We have to
Completely. It's
trace
very
it back.
complementary.
Yeah, for sure. For sure.
Definitely. So, with the combination of, conventional medicine and functional medicine, just I really try to do some deep dive diagnostic testing to identify the root cause and treat the actual disease foundation itself. I do a lot of different things: hormone balancing, replacement, supplementation, IVs, lifestyle modification, nutritional counseling, peptides.
That sounds amazing. Can I ask you, what are some of the diagnostic tests that you use to kind of get to the root cause of
Yeah.
some of the issues for your patients?
Absolutely. Yeah. So there's a lot of different things that we can dive into. And I really let the story, like the history of the individual that I'm speaking to guide me, because we're all
Mhm.
individuals. I don't believe that we're all in an algorithm, that everything that I do is going to be tailored to that person. So, if somebody's coming to me and they have a history of fatigue, I see a lot of people with fatigue issues.
Mhm.
I want to learn about their family history, their past medical history, their lifestyle, which can kind of help me understand certain testing to incorporate. And so maybe that's, a blood panel that we can go through, a conventional lab like Quest or
Mhm.
LabCorp. Or
Mhm.
maybe from their symptom history, they might need a deep dive into, like, say, mold testing. Or is it something specific with, their thyroid or heavy metals? Or is there, different things like that. But overall, I love, there's a lab called Genova. They do a lot of gut
Mhm.
health analysis and micronutrient testing. I love ZRT as well. They do a lot of different hormone testing, including cortisol,
Mhm.
hormone metabolites. The Dutch test is another good one. So we can
Mhm.
really do a deep dive on how your body is processing your certain hormones, and try to, address the certain issues that you're having based on what we see. So those are just a few of them. But there's a lot of really good laboratory companies out there.
That there's so much to choose from, but that sounds perfect, integrating the blood serum lab testing and some of the functional medicine tests. I love that approach. And especially how you were mentioning, you really try to get to know your patients and their history, their health history, their family history before you kind of decide, what tests should I run for this patient?
Mhm.
Because, the functional medicine tests, they can be a little bit costly, especially since a lot of more are paid out of pocket. So I love your approach of really refining it and seeing what patients really need. So I have
Completely.
so many questions for you, Julie, and these are common questions that I get from my patients. So bear with me. I'm going to go through several.
I love it.
And you described a little bit about your specialty and the area that you practice in. But what are some of the areas that you love to practice? What's your practice passion?
Yeah, my practice passion, I started out being go see Julie for your hormones. Like, I love dealing with hormones. I love dealing with men and women. And I love helping my patients feel better without needing to use conventional therapies or like needing to be on a medication. And hormones can really help with a lot of that.
I love that. And as far as hormone therapy for women, what are the different types of hormone therapy available? And I think most of us are familiar with HRTs, which is usually what your OBGYN or your gynecologist prescribes for you.
Mhm.
So, can you tell us a little bit about the different types of hormone therapy?
Yeah, absolutely. So, um, we can get into like conventional versus like bioidentical
Yes,
right
please.
now. Okay.
Mhm.
All right. Yeah, definitely. So, um, as women, we change every single day of the month, right? When we are menstruating. And then, reaching into perimenopause when our hormones are shifting down, we have these big fluctuations of estrogen, surges of FSH and LH. We have different hormone demands and needs than when we are in postmenopause.
Mhm.
And so I'm a huge advocate for starting hormone therapy within, the first 10 years of menopause, because it can really, really sharply reduce the risks of cardiovascular disease, strokes and heart attacks.
Absolutely.
So that's crucial. And so if I'm going to
Mhm.
be putting, offering hormone therapy for a woman, I'm always going to choose a bioidentical hormone.
Mhm.
And so what that means is, bioidentical is the exact same molecular structure as our own hormones. Imagine like the hormone and the hormone receptor fitting together perfectly, like a lock and key. And so it creates a whole cascade of anti-inflammatory results, preventing strokes, heart attacks, cancers, UTIs, thinning bones, thinning hair, thinning skin, neurodegenerative decline. Like, it's so good for us. We have receptors on every single cell in our bodies for these receptors. And so, choosing a bioidentical option is going to be really safe and anti-inflammatory, and has been again shown to reduce the risk for cardiovascular disease, which is, you know, across the population, heart disease is the number one cause of death, right?
Mhm.
Everybody thinks that we're going to die from cancers, but it's actually cardiovascular disease. So
Right,
preventing
right.
that is huge. Um, And that's in opposition to going with a conventional hormone treatment. So that would be, some brand names that people are familiar with are Premarin,
Mhm.
Prem-Pro. Might recall that. Women were using a little bit more in the 90s and the early 2000s.
Sure.
And these hormones are, the Premarin, for example, is taken from a pregnant horse's urine. So it's a conjugated equine estrogen. So it's been metabolized by the horse, and they were able to take the urine and pretty inexpensively put it into a pill form. And women started taking it because it really does
Mhm.
reduce the vasomotor symptoms, the hot flashes, and the sweating episodes. But what they found was is that these hormones will really increase a lot of inflammation. So in the Women's Healthcare Initiative in 1991, they found that they did a couple different groups of women that were all on these conventional hormones.
Mhm.
And so the first group of women, well, all these women, first of all, um, it was a poorly run study. They took the first group of women who were, on average age 65 plus, which we've already mentioned that the best time to start hormone therapy is within the first 10 years of menopause. And that's,
Mhm.
on average age 51 is the, usual onset. And so that's well over 10 years. And so we've missed the critical period for preventing cardiovascular disease.
Sure.
And so they start them on these hormones. And, the first group of women, they had hysterectomies and they were only gave them Premarin. So it's only estrogen. And they
Mhm.
found that in this group, huge increase for strokes. So they stopped the study prematurely there. The second group of
Wow.
women, they were given Premarin and progestin, not to be confused with estrogen and progesterone, which are the bioidentical
Mhm. Mhm.
versions of it. So these conventional hormones, they let the study run on a little bit longer, but we later discovered that because these hormones, these conventional hormones, do not fit in the receptor site like a perfect lock and key does, it stimulates a cascade of inflammation, increasing the risk for strokes and heart attacks and cancers. So this is something that I do not advocate for, and I would never prescribe for my patients.
Mhm. Well, I mean, this all makes so much sense. I'm just curious why a patient would choose to not use bioidentical hormones.
Right, right. Well, there's so many
Right.
options, right? Like when we're,
Mhm.
as women, when we are making this big transition over 10 years of perimenopause, our options. And I think that a woman should have the right to make her own decision off of whatever option she chooses, but it has to be an educated and informed decision about the different options to her. If she chooses to go the supplement route and not be on any type of hormone,
Mhm.
she can do that as long as she's aware that she will miss a lot of the benefit of being on hormone replacement, like reducing the incidence of strokes and heart attacks and morbidity and mortality. Um, so that's essential that she's aware of that.
Right.
Um,
Right.
and then, being aware of the risks that go associated with conventional hormone replacement and then bioidentical hormone replacement.
Well, so this kind of spurs a question from a lot of my patients, and I myself am curious too. So, if the window of time or the best window of time to start bioidentical hormones is in that 10-year time frame within menopause, how long are most women on hormones for?
So let's tackle the conventional hormones first.
Okay, sounds
Conventional
good.
hormones being the not bioidentical, the ones that cause
Mhm.
inflammation.
Mhm.
Doctors will say, conventional doctors will tell you to not be on them at all, or to be on them for the least amount of time needed to get through your strokes, or excuse me, your hot flashes and
Mhm.
sweating episodes.
Sure.
Um, and by the way, menopause, I don't think should be defined as hot flashes
I was just
and
thinking that,
sweating
Julie. I was
episodes.
just thinking about all the patients that I see that are going through the transition
Yeah.
and how hot flashes is just like a little piece of it. I mean, there's
Yes.
so many other things that and just kind of sidebar note for me, I'm in that phase right now, and so I'm, like, firsthand experiencing it, and it's so much more than just a hot flash or a night sweat, the
No.
things like the memory changes,
Yes.
the insomnia. Like,
Yes.
that, I think, is more than anything for most women that I
Yeah.
see, they're complaining about not being able to sleep, and
Yes.
then their mental acuity has declined because of the lack of sleep.
Yes.
So if you can speak to that too, and,
Yeah. We can dive into that. We call it like loss of executive function is that brain fog, like issues with
Mhm,
calculations. You're not as like you feel like you're not as sharp as you once were.
right?
And statistically speaking, like 1 out of 5 women in the postmenopause phase quit their jobs because of this.
Wow,
We
that's
like it's
way too
affecting
many
our
women.
lifestyle. It's affecting
Yeah.
our livelihood. It doesn't
Mhm,
make sense that we shouldn't address that. And the fatigue and the sleep, huge. Like you need
mhm.
your sleep for so many different things. Like 15% of our metabolism is ingrained in our sleep, right? And then
I mean,
the
I can't even imagine how our adrenals are handling all
yes,
of it too.
our
Yeah.
cortisol,
Mhm,
absolutely. And
mhm,
then, mental health changes, like 40% of women are going to experience, either anxiety or depression in this phase of our lives. Our estrogen have a huge impact on our dopamine, which is our neurotransmitter for pleasure, mood, cognition, our serotonin, our happy hormone. Sure, it's primarily made in the gut, but our brain still makes some of it. And it's heavily
mhm,
influenced by our estrogen. Acetylcholine, really important for muscular contraction is what we think of it, but also for memory and mood. And estrogen helps make all of these. So without having that backbone to create our neurotransmitters, we have a huge prevalence of mood issues. And even we'll see 400% more mood issues in women who have a history before peri or postmenopause
mhm.
of anxiety, depression, or postpartum issues too.
Sure. So it just gets heightened in this
Yes.
phase. I've been talking to a lot of my patients that have, I've treated from postpartum, and a lot of our patients are coming to us a little bit older, so they
Right.
perhaps needed some assisted reproductive techniques to get them pregnant, and then they're kind of falling into that perimenopause, or maybe they were already in perimenopause before they had their child. So one of the things that I've noticed for those patients is, the postpartum is rough, right? And the recovery can be tough. And like you said, everyone experiences a little differently. But then the perimenopause and the menopausal transitions can be just as tough, except that you have similar symptoms, the hormone imbalances, the hot flashes, the moodiness, the fatigue, except you have no baby. And
Yes.
and at
Completely.
least
You have
when
nothing to
you
bring home.
right, at least when you're in the postpartum phase, you're like, okay, it's worth it because I have this beautiful baby that I've been longing for all these years. But then when you go through menopause, it's like, okay, well, I have nothing to show for this.
Yes.
I just
Yeah.
I feel like crap. And
Totally.
right? So it's I have to say us women are like the most resilient beings
I
because we go
know.
through all these different phases in life that
Completely.
challenge us and kind of take us to this next level of,
Yes.
really fighting to optimize our health.
Yeah.
So, I'm sorry,
Completely.
I kind of transitioned us out of the first question.
No, I know, but I think it's so like important to talk about those symptoms, right? Like people don't think that palpitations are associated with menopause. There's a huge impact there, or joint pain. We have so many musculoskeletal conditions that come up, body composition changes, even gut
Mm,
health changes. We have total changes in our microbiome. Maybe we can't even tolerate certain foods that
yes,
we've been eating our
right.
whole lives because of our hormone changes. We get bloating.
Mhm.
So I think it's imperative to talk about that. And I love that you brought it up.
Thanks, Julie. Yeah, so you were starting to tell us about how
How long to stay on hormones.
how long to stay on hormone therapy.
Yeah. So with the conventional therapy, they're going to say it as short amount of time as possible. With
Right.
the non-conventional therapies, the bioidentical, the anti-inflammatory, we can stay on them for the rest of our lives because they're so anti-inflammatory and protective. So
Wow, that's amazing. I didn't know that.
yeah, we definitely can. And so, um, I really am going to tailor it to the woman, right? Like if she, for some reason, wants to get off of it, or there's something that is leading her away from hormones, we're going to talk
Mhm,
about it.
mhm.
But I have a patient in her 90s who's on hormone replacement. She's thriving.
Wow, that's incredible.
Yeah.
And how old did she start her bioidentical hormones?
She started her bioidenticals a little bit later in life, so she was approaching 60.
Okay, okay, but still within that 10-year window. And
Yep.
I would imagine there's a lot of monitoring that you do in
Oh,
terms
yeah.
of testing her hormone levels.
Mhm.
And is there generally like some tweaking that needs to be done in terms of dosing and
Yeah.
administration?
Absolutely. Yeah. So,
Mhm.
as far as testing goes, I am going to start all of my women that I'm going to put on bioidentical hormones off on a low level because there's various ways that I can administer hormones, which we can get into as well. But I never know how well somebody's going to absorb.
Sure.
There's certain hormones that we put on our skin, like a patch or a cream. Some women are under absorbers. Other women are hyper absorbers. And I just,
Right.
I'm not really sure where
Yeah.
somebody's going to fall until
Mhm.
we start. And so just to avoid overshooting, because like you can have too much water and it's a bad thing. Like too much of a good thing is a bad thing. So kind of the same goes for hormones. We just have to go low and slow and see what's right for you,
Mhm.
and tailor your dosing to you. You're an individual and you have different genetics, and you're going to have different symptoms than the next woman maybe who's on the same dosing.
Right. That's a good
So,
point.
yep. So low and slow, and then we can kind of get you to a level where you feel like yourself again,
Mhm.
right? Where you don't have the brain fog. Your organs are protected. You're sleeping through the night. You're feeling like yourself. And so, we kind of go low and slow until we hit that mark. If we're doing topical hormones, I'm going to want to check labs about every 3 months.
Mhm.
If there's something going on in between there, I'll go based off symptom management, or sometimes I will get labs again. I do pellet therapy as well. And again, starting off with low dosing. I think that the problem with a lot of these therapies is that a lot of providers, though they have good intentions, will sometimes dose too high.
Can you tell us a little bit about pellet therapy? And this is one of the questions I had for you was what are
Yeah.
the different forms of bioidentical hormone therapy? And
Yes,
pellets being
absolutely.
one of them that's becoming really widely popular,
Yeah.
just because you don't
Mm-hmm.
have to think about it and like
Mm-hmm.
apply something on a daily basis or multiple
Completely.
times a
Yeah.
day.
Completely. Yeah. Traditional hormone replacement has been with, in terms of bioidentical, I won't ever
Mhm.
do like an oral estrogen, just increases the risk for clots twofold if it's bioidentical, fourfold if it's not. So, taking that out of the equation, say we're going to do an estrogen, topical forms are either like a patch or a cream. The
Mhm.
patches will apply usually twice a week, sometimes once a week. Creams are
Mhm.
going to be in every day. For testosterone, we're going to be doing typically a cream every day. And the creams are great, but they do take a little bit of time to dry. Some people are under
Mhm.
absorbers, like I was saying. Some people
Sure.
forget. Sometimes they could be challenging to fly with. But overall, I think they're a great option. But then, for people who are, say, avid swimmers, sauna goers,
Mm.
yogis,
Right.
or just have a really bad time habit stacking, bringing in a new medication or program into their diet, into their lifestyle, pellets can be really helpful. Or for my underabsorbers too. So a pellet is an in-office procedure where I numb you up and make a very tiny incision and under your skin into the subcutaneous layer of fat that we all have. I put pellets there. And these pellets are like half the size of a tic tac, and your body grows a bed of capillaries around them. And over the next, typically for a woman, 3 to 5 months, your body will take away some of the hormones. It's based on cardiac output. So if you are working out voraciously, then you're going to, run through your pellet much faster than somebody who is walking and gardening, as their exercise.
Sure.
So it's going to vary. The cadence is going to vary from person to person, and testing for those, those labs are a little bit different as well. It's about every 6 weeks after the pellet for a woman. For a man, it's different, but we can get into that on another day. Um, and
And
then
so pellets, just to kind of go back to what pellets are like, how often are they prescribed or
Mhm.
inserted into you?
It's about every 3 to 5 months for a woman, and again, just based on cardiac output. So, if you're a very active woman, you're looking at 4 procedures a year.
4 procedures a year, okay. And then I would imagine that lab work is done to kind of see how they're absorbing the pellets?
Absolutely. We can do them 6 weeks after the pellet to kind of see like where is the peak and the plateau. And there's newer research coming out that it can also be beneficial to do it maybe at like the 12-week point, like before they're just about to get the pellet.
Okay, great. Well, that sounds like such a convenient way to administer bioidentical hormones.
Yeah.
Is it a static dose for everybody, or how does that work for the pellets?
Like all methods of hormone replacement, it can be tailored to you. So again, I'm going to start low and slow, but I want it to
Mhm.
be still impactful that you feel something, but still don't want to overshoot. So again, yeah, that can. So I guess the short answer is yes, it can be tailored to the specific dosing.
Nice. And what are some of the common hormones that are included in the pellet?
Yes. So the pellet will be estradiol. So that is our most bioavailable estrogen throughout our lives.
Mhm.
And then testosterone. So testosterone is not FDA approved to treat women in general. However, it is our most bioavailable hormone throughout our entire lives as women. So it doesn't really make sense to me that it's not FDA approved.
Mhm.
And there's also a lot of evidence out there that shows that women in the highest quartile of testosterone have better muscular health and better
Mhm.
bone health. And I'm all about preventing osteoporosis and osteopenia in all of my patients. So I am an advocate for testosterone therapy. For the pellets, though, those are the only two hormones that would be in the pellet. If we're doing a progesterone, which I'll always do a progesterone and estrogen together because those have to
Mhm.
go together. I prefer doing progesterone as a pill. It's safe to do that way at night before bed because it can really help get you into a good deep sleep. Very anti-anxiety, very calming,
That
be very
that
helpful.
sounds perfect for all the insomniacs or the women that have become insomniacs in the
Yeah.
perimenopause phase.
hmm
Would you ever pair the pellets with progesterone creams?
Yes. So there is some limited data out there that came out of Europe that if we could do a progesterone cream, at a very specific dosing, I believe it was 30 milligrams cream, that we can provide adequate uterine and breast protection.
Mhm.
So unopposed estrogen is, something that we want to avoid, even in women who have hysterectomies, just to be able to make sure that we can protect all their organs. Um, and so, yeah, that is something that I have done historically.
Okay, great. Wow, this is so fascinating. All the different options.
Yeah, there's a ton of
Who,
different
who
options.
knew that you can have these different options? What would you say is the most common form of bioidentical hormones that you prescribe in your practice?
Mm, I don't know. A hard question. Um, I think that hmm, historically, I have worked in practices where the pellet was the primary source
Mm.
of hormone replacement. Currently, in my practice, I think that it's more topical hormones. Now that I'm
Yeah, I
thinking
was
of
going to
it,
say, are most patients starting off with topical first
yeah.
before they move on to pellets?
Yeah, I think so because the pellet I can't take out. Once it's in, it's in. So the nice
Mm-hmm.
thing about tapering the dose, adjustments or stopping is nice that you can just kind of easily, take the patch off or adjust the cream or whatnot
Right.
with the topicals. It's a good place to start, and then sometimes we graduate to the pellet if the routine isn't working.
So would it be kind of a good precursor? So if somebody says, I want to start pellets, but I'm hesitant because I'm
I'm not sure if
afraid
I'm gonna
that the
like it.
yeah, or if the dose is too heavy for me, would you start somebody on creams first just to kind of get to know their body a little bit better?
Yeah, and that's totally an option. The way that I like to see my patients and I working together is I really look at it as teamwork. Like I
Mhm.
only know so much about their symptoms and what they're going through to what they tell me. And so I want them to be aware of all their decisions and we can move forward with that together. And so if that's, starting off like maybe with like a creamer or a patch first and then seeing if they like it and then moving to the pellet, great. I have a lot of
Mhm.
other patients who know that they will not remember to apply a patch or a cream. They just want to jump into the pellet and
Yes.
they still get really good
Right.
results.
Right, right. It's kind of like when you prescribe a supplement 3 times a day, the patient's like, "I'm not gonna do it.
Yes.
I'm not gonna remember." Maybe
Yes.
once a day. So
Mhm.
I can see where the application of topicals could be challenging,
Yeah.
especially if it's a couple times a day.
Right.
So what about libido? That's a big one. I
Mhm.
get a lot of patients that complain about, decrease in libido and vaginal dryness, and those two usually come together in this phase of life. So I'm curious to know what bioidentical hormones, or if it's not just one but a combination of hormones, are the most effective in helping with those symptoms.
Helping with libido.
Mhm.
Yeah, absolutely. So libido is multifaceted. It is not just testosterone, right? Like testosterone, of course, is what we all think of as being really good for libido. But
Mhm.
I think where a lot of people forget is that estradiol, huge impact on libido, and you need that balance with progesterone. So they all have influence. Your thyroid has to be in balance for your libido to be good. Your
Absolutely.
neurotransmitters have to be
Mm.
in balance as well. Your relationship with yourself, what you think about yourself is can also really, determine if like the sparks are flying, right? What you think about your partner, how safe do you feel? Like, there's so many different things. So
Sure.
definitely, making sure that all of those hormones are in balance can have a huge impact on libido. There are also peptides that can help with libido,
Okay, great.
specifically PT141
Mhm.
is a peptide that was developed for women who have a total lack of sexual drive. They called it a disorder, and so medication was made, but it's actually a peptide. So that's something that can be really helpful. Um,
Can you tell us a little bit about peptides and what they are
yeah, yeah, of
and
course.
how
So
they're used?
So peptides are these short chains of amino acids that give your body a message to carry out. And the message could be anything, including stimulating libido or maybe increased hair growth, or, we're all familiar with the weight loss peptides, I think, that are
Mhm.
circulating out there, but also mitochondrial peptides. There's almost a peptide for everything. And it's because that's the way our body communicates is through these little sequences of amino acids, peptides, to send messages all throughout our bodies.
Wow, it sounds like everyone can use a peptide treatment.
Yeah, I think so. So definitely when it comes to libido, that can be really helpful. Oxytocin is also can be really helpful for libido.
Mhm,
It's a neurotransmitter, almost acts like as a peptide.
mhm.
And there's some formulations out there that use oxytocin and PT141, the libido peptide, together to help stimulate that drive. And so oftentimes it'll be available in like a nasal spray or dissolvable under the tongue that you can use like 30 minutes before.
Fascinating.
Yeah.
Wow, I'm learning so much from you, Julie. I didn't know all these things were available, and especially, well, through the nasal passages, like we're so accustomed to hearing about topicals and orals and vaginal and
Mhm.
pellets, but that's crazy.
Yeah, there's a
You
whole different world out there of like different things that we can use.
I love it, but that's a fast acting way to get something to work.
Yeah,
And that
absolutely.
makes a lot of
Mhm.
sense.
Mhm.
So, as far as the peptides, what is the most common uh, form of peptides that you use in your practice for your patients?
Right, right. So peptides, they're going to be most of the time most bioavailable through an injection. There
Okay.
are seldom peptides that you can actually take orally. One of them is BPC 157. It's a peptide that we all actually make in our gut. It
Hmm.
stimulates gut healing and repair, but it's known as the body protective compound, BPC. However, it's also known as the Wolverine peptide because it stimulates massive healing and recovery. So if you're
Love
thinking
that.
about Wolverine, when he ever
Hmm.
he gets scratched, he's like
Right.
instantaneously healed. And
Yes.
so
We
there's
all want to be Wolverine.
yes, we do. And so everybody's, my patients are like, "Can I get the Wolverine peptide?" I'm like, "Oh my gosh."
Now, do they see results right away or does it take a couple of treatments?
It's going to vary from person to person. For
Hmm.
peptides to really work well, we have to, and kind of like all therapies, and when we're moving holistically, we need a
Sure.
really good foundation. So we need to
Mhm.
make sure that you have enough amino acids to make sure that your body can read the message and then make a cascade of events of other peptides to follow that message. That you're getting adequate sleep, that you're hitting your protein goals, that you have enough nutrition, right? Enough micronutrients, vitamin C and CoQ10, and that your mitochondria are working effectively. So some
Right.
people, I just injected BPC 157 and TB4. It's a combo to really stimulate healing and recovery into one of my patient's knees. And she texted me the next day and said, I can't believe how well I'm able to walk today. When can I come back in for more? And so
That's
it's
amazing. I love
amazing.
that.
Other people will
Yeah.
tell me, after a week that they feel so much better. The
Mhm.
studies are leaning more towards a month of use, but I see results much faster.
What's the cadence of treatment usually for
It really
peptides?
depends on the peptide.
Okay.
So, some peptides we can use daily. Other peptides are once a week. And then I like to cycle peptides. I don't like keeping somebody on a peptide for a prolonged period of time. I like to follow our own body's natural rhythms. And so,
Mhm.
giving peptides maybe for a period of like 1 to 3 months and then backing off, giving you a break because your body's created that pathway that now
Mhm.
you can follow on your own for a period of time until maybe you need another boost to help your body remember how to heal your gut or how to increase libido or how to grow hair or whatnot.
Okay. That sounds perfect. So
Different
if
things
a
like that.
patient is using peptides for hormone balancing, are they able to also, if a patient is having hormone issues and they're trying to get pregnant, would they also be a candidate to try peptide therapy too?
Absolutely. There are no studies on women who are pregnant on peptides. So that's not something that I will be the first to endeavor,
Okay.
just for my patient safety.
Sure.
However, if our goal is to reduce insulin resistance and get our mitochondria working well and reduce inflammation, we're talking about egg quality here, right?
Absolutely.
So if we can improve the egg quality that way and help her achieve her goals pre-pregnancy, then that's when her body is able to give to creating another life.
Sure. So more of a peptide treatment protocol in sort of that preconception window.
Yep. And then post conception as well.
Nice.
I'm again, there's no studies on peptides in breastfeeding.
Mhm.
So I would wait until the breastfeeding is over.
Got it. Okay.
Just because again, I don't want to do something that's not studied enough. And then be able to reincorporate it again if she needed it.
Well, I would imagine that when patients are getting the right care for preconception care, that their pregnancy is going to go smoother. Well, first, they're going to be more fertile, and then their pregnancy is going to be smoother, and hopefully their postpartum recovery is also
Yeah,
better too.
completely.
So, I'm always thinking about how can we impact and improve our patients through all phases of life. So it's great to know that peptides is another tool in your toolkit
Yeah, they
to
definitely
provide.
are.
One thing that we haven't talked about yet, which I know that you have in that's a big part of your practice, is actually IV therapy. So how does the IV therapy kind of blend in with all of the other cool things that you do?
Yeah.
Peptides, bioidentical hormones, like how does that get incorporated into your treatment plans for your patients?
Definitely. It's a great question. So, IV therapy, I'm going to, be able to give my patients different types of vitamin infusions based off of their needs.
Mhm.
Whether it's improving immunity or reducing inflammation or athletic recovery, there's lots of different things that we can do IVs for detox, even, right? Like huge
Mhm.
impact there. So, all kind of preparing the body for the marathon that is life, including conception and delivery and whatnot. There's of course IVs that we can do for women who are currently pregnant or have just given birth, et cetera, and that can be safe.
Oh, that's good
So,
to know. I didn't realize that IV therapy was being used. I mean, the one thing that we're familiar with is intralipids, and that's,
mhm,
used leading up to pregnancy, especially for women that have had some kind of recurrent loss issues. But
mhm,
I see it a lot in IVF treatment protocols too. And then
mhm.
into the first trimester, usually another one or two
Yeah.
intralipids. Is that something that you offer in your practice too?
Interlipids? No, it's not. I'll have to learn more about that through you.
Yeah, there's a huge trend for that,
I love
especially
it.
for IVF patients.
I love
But
it.
but
Yeah.
what type of IVs are you providing for your
So,
patients?
there it really just depends on the person. So, we talked about some of the vitamin infusions. The vitamin infusions, why I love them so much is because you're going to have a 100% of the vitamins through the IV bioavailable and ready for absorption. You're not going to hit the first pass of the liver if you take something orally. So, it's only
Sure.
going to render like maybe you'll be able to use 20 to 80% if it's a really, really good supplement for absorption and for you. So, we lose a lot of that in the first pass effect. Of being broken down by our liver. So that's why, certain vitamin therapies, it's for 100% absorption. I think it's a game changer and you can really feel the effects. Other than vitamin IVs, I do an ozone IV, which I was able to have you in the office and give you one a
Yes.
couple weeks ago.
That
Um,
was incredible. Thank you, Julie. That was such a cool experience.
yes, it's such a unique IV. So, for our listeners, it is a process where I draw some blood, I heparinize it so that it will not
Mhm.
clot. It's safe to stay outside the body for a little bit of time. I put it in a bag with a little bit of saline, and then I take ozone, which is a gas. So, I have an oxygen machine and a compressor that pushes an extra molecule of oxygen onto the O2 to make it O3. And when I inject the O3 into the bag with the saline and blood, a chemical reaction takes place outside the body, which makes it safe because ozone, if we just breathe it in, is not safe for our lungs.
Mhm.
But outside the body with the blood, it is safe, and it stimulates a whole cascade of events from the interaction of the O3, the ozone, with the protein and the fats that we all have in our blood. And this cascade of events can, you might feel it the first 3 days with maybe a little bit of lift in energy,
Mm.
detoxification, but this cascade of anti-inflammation can last up to 6 months.
That's incredible. Well, I will
Ozone,
definitely say I was energized after our session to the point
good.
where I had a hard time settling down for sleep.
Oh no.
No,
Okay, so
no, it
then
was totally fine. It was totally fine.
we'd have to
But
maybe do it earlier in the day for you.
maybe, but it ended up being fine because the next day I was off, so it was totally fine.
Good. Okay,
But I
good.
can see where it can definitely stimulate the energy and help kind of, boost your chi a little bit. So
Yeah. Oh, I love that. Boost your chi. Yeah, it's immunomodulatory, it's antifungal, antiviral, antibacterial. It's one of my favorite IVs.
I definitely can say that I have felt immunity wise a lot better. My allergies haven't been affected like they normally are during this time of year.
Good.
So I can speak to that for the
I love
ozone
it.
IV for sure.
I love it. Supports mitochondria, recruits stem
Yeah.
cells. It's incredibly anti-aging.
I love it. I love
Mhm,
it. I love it. So there's so many different options in IV therapy, but one question in terms of nutrients for pregnant women,
mhm,
anemia tends to be a very common
mhm.
thing that comes up for women. So I was just curious, is that something that's commonly prescribed by you, or is that a common IV that you provide your patients?
So currently, the iron IVs are so hard to get. I've been
Mm.
struggling getting them. So
In an
that's
ideal world,
in an
would it?
ideal world, I would have it and I would give it
Okay.
because
Okay.
I think that it is underprescribed. I have a lot of women in
Mhm.
general, even as we're approaching perimenopause and menopause, we have dysfunctional uterine bleeding and we can have, whether it's painful periods or just from pure utter loss of the volume of blood
Right.
renders us anemic. And so there's a hormone disruption there that we need to address, the estrogen and the progesterone. Maybe there's some fibroids, which is, a symptom of estrogen dominance. And if we can't keep up with the blood loss, we become anemic. And our iron heavily affects our neurotransmitters. So we can see depression and fatigue. Our workout potential comes down. And then these women are also caregivers, right? They're caring for their
Right.
families and their significant others or work, right? So these women are going nonstop and there's not enough reprieve for them.
Yeah, well, that's too bad to hear about the shortage of iron infusions. So what
Mm.
would be the next best option for patients that need iron support if the IV therapy isn't available?
You're right. Sometimes I will refer out. just if, it's a severe
Mhm.
case. It's shocking to me how many times insurance will deny it,
Ugh,
which is an
yeah.
issue.
Mhm.
But if they can't, if we can't get an IV, then I'll
Mhm.
go for an oral supplementation. So I want to make sure that we're taking iron with vitamin C and, other
Mhm.
basic nutrients to make sure that we're fully absorbing it.
Sure. Okay, great. That's good to know.
Yeah.
Yeah, and I know that, like you said, that everybody absorbs at a different rate too.
Yeah.
So it's tough to know. But I guess the labs are the telltale sign whether the treatment is effective or not.
Yeah, definitely. And I also want to hear that, oftentimes with IVs, it'll take 3 treatments for them to feel better.
Really. Yeah.
Yeah,
So,
it's a long
well, I hope
road.
that that comes back to be available soon
Yeah, I hope so.
because that's something I would definitely refer a lot of patients to you for,
Thank
would
you. Yeah,
be
I'll let you know.
iron supplementation for sure through IV. So what are some of the most common things that you treat in your practice outside of bioidentical hormone replacement?
Yeah. So I see a lot of people come to me for fatigue issues, which, can be embedded with hormones or what I think a lot of people don't realize is that our fatigue can come from our food sensitivities. Maybe it's our thyroid.
Mhm.
So I see a lot of people for gut health. Cortisol, like our adrenal health, is another big one.
Mhm.
Um, People, when they're coming to me for a certain issue, whether it's, one of those things that we listed or sleep, right? Like we're going through some like investigative work to fix some of the underlying issues. Other people come to me totally healthy, just looking to optimize themselves,
I love
right?
that.
Yeah.
Yeah,
And then there's
prevention.
completely preventative,
Yes.
which just
Mhm.
what this is, right? Like I want this to be completely preventative and help my patients feel their best at whatever stage of life.
Absolutely.
And then there's a third sector of patients that come to me because they're looking to enhance athletic performance.
Mhm.
So whether that's, a race car driver, a swimmer, a pilot, you name it, they're always looking to just enhance that activity level.
Right. The best version of themselves.
Yeah.
That's awesome.
Completely.
I love your broad spectrum practice.
Thank you.
So Julie, tell me, do you have any upcoming talks or events or anything exciting coming up for you?
Yes, I do. So, this weekend, actually, I'm not sure if this podcast will be out by then, but December 7th, I'm having a grand opening party, which of course you're invited to.
Thank
I
you,
moved my
Julie.
practice about 6 months ago, so it's taken us a little bit of time to settle into our new location, but, finally opening up the doors and just welcoming in our health community, for how much we appreciate them and their support. So we'll be doing that this Saturday. And there I will be speaking about a reveal, which I've told you about, and you're one of the first people to know.
I feel so
So,
honored.
yes. So I'm at the event. I'm going to be unveiling an ebook that I wrote about peptides. So
Wonderful. Oh, this is perfect. I'm so glad we talked a lot about the peptides.
yeah, I'm really excited. So in this book, I wanted to touch on like the different uses of peptides to raise awareness about peptide safety and lightly
Mm.
touch on some peptides that I like. It's by no means like comprehensive and really science forward,
Mhm.
but I just wanted it to be really palatable for a big, wide audience of readers, regardless of background. And so also to stimulate interest in various type of peptides, not just for weight loss.
Right.
Um,
Because I know
yeah.
that's sort of the trend right now is the peptide talk is all about weight management, weight loss.
Mhm. Right.
So,
The
yeah.
question is, are peptides right for you?
Mhm.
So that would be, maybe take a look at the ebook, and if you're curious.
How do folks get a hold of that ebook after you launch it, of course?
Yeah. So I'll send you a QR code that maybe you can put on
Perfect. I'll add that
somewhere,
to
or
the
maybe
show
link to
notes.
my site. Yeah,
Yeah, for sure.
we can do that.
So, I think the release of this podcast is not gonna be till the new year.
Oh,
So, I
good.
think it'll be after your reveal.
Yeah, that's perfect.
I would love, love, love to include it in the show notes.
Perfect. Yeah, I would love that.
Well, wonderful. So, do you have, Julie, any other words of wisdom to share with our listeners today? Any advice that you would like to share for women in all phases of their life?
Yeah. Ooh, I think that, yeah, in general, I love helping my patients, like I've kind of mentioned before, prepare for the marathon that is life. So focusing on, the foundations and maybe altering the way that society thinks about women as well. Like being strong and not focusing on being skinny, hitting your
Mm,
protein goals and not, slacking off for, the concern of like an appearance or
sure.
whatnot, and really focusing on yourself, because when you can preserve yourself and your own health, that's when you can help others.
I love that. That's perfect. Thank you for sharing that.
Yeah.
And I think it is important to stress that, it's more important to be the healthiest version of yourself, not the skinniest version of yourself,
Yeah.
but the healthiest and most nourished version to be
Completely.
able to sustain the demands of life.
Completely.
So, well,
Mhm.
Julie, I'm going to share all of your contact information in this podcast and the show notes. And I just want to thank you so much for being a guest on my show. And I am excited for your grand opening.
Yay.
And yeah, and
Thank you so
Julie,
much for having me.
absolutely. Thank you. It's been such a pleasure. All right,
Thanks.
Julie, you take care.
All
All
right, see
right.
you
Thank you
soon.
so much.